Hello, my name is Kendrique Morgan, and I'm from Port Gibson, Mississippi. I attend the University of Mississippi Medical Center, and I'm a second year DPT student. The first question was physical therapy has once been described as a way to increase patients' quality of life and function. If you had the opportunity to change one thing to increase the quality of life for people in Mississippi, what would it be? I stated it would be poverty. And then it asked why. I said, based on the 2019 census, 19.8% of individuals in Mississippi are living below the poverty level. Poverty levels have shown to have an inverse relationship with healthcare. It has been shown that those living in poverty are less educated and less likely to seek the proper healthcare treatment. It has also been seen that those individuals that living with healthcare leads to a high obesity rate of children, and that turns into a slippery slope of healthcare issues throughout their life and an increase in illnesses, disease, obesity, and medical complications, which also leads to an increase in medical bills and financial burden. So, what challenges, issues, or causes would I prioritize? The issue would be to start a change at the administrative level. This change must come from the governor, the legislator, and politicians to prioritize people's health care. The people must educate each other and push the movement of change. What do you hope to achieve, and why is it important to achieve these goals? The lesson is that we cannot be a great state if we have so many that are struggling to eat and survive. If there was a situation where one had to choose a doctor visit or their rent or a meal, I'm certain that they would probably choose to eat. So the social dynamics and the debilitating factors of poverty have a very, very inverse and direct correlation with a decrease in healthcare and a decrease in function and overall health. Discuss who your plan will affect and why is it important that these people are affected. So a healthy mind and body goes hand in hand. I strongly believe that if we address the social dynamics of those living below the poverty level in Mississippi, we can improve the quality of life of so many in our present and to come. We can affect generations. Yet, until we address these issues, we are doing a disservice to all that are healthcare workers and those patients that we value so much. What do you expect to gain from this experience, personally or professionally? I expect that someone in life will be altered in the most beneficial way, and that through that, they will take it upon themselves to educate and help another individual. I expect that in turn, that this movement will spread like a wildfire, and there will be a decrease in child obesity, mortality rate, chronic diseases. There will be an increase in fresh food and a decrease in fresh food deserts. And I expect that people will live longer, happier, and be more functional, which increases their livelihood, decreases the risk of illnesses, disease, and physical impairments.